Nursing Challenges Childhood Obesity. Angelique Lestagez, Jennifer Knight-Rains, and Sarah Gradwell. Middle Georgia State College, BSN Program, Dr. Pierce, Nursing 3000.
Childhood obesity is a growing problem that is running rapid in today's American society. Obesity is defined as having a BMI or a body mass index over 29.99. The BMI value is based off the patient's weight to height ratio in comparison to other children in the United States. Childhood obesity is having a BMI that fits the obesity requirement, but that also puts the child's weight at a 95th percentile in comparison to other children their age.
The causes of childhood obesity are numerous: heredity, socioeconomic status, lack of or deficiency in adequate exercise, and dietary patterns. Although the child's hereditary and socioeconomic status cannot typically be changed, the other causes of childhood obesity can be tweaked so as to avoid developing obesity or decrease weight gain.
The development of childhood obesity greatly increases the child's chances of developing certain diseases and conditions that are of major concerns to the child's health for the present and future. Studies show that obesity is strongly correlated with cardiovascular disease. Since cardiovascular disease is the #1 killer in the United States, the development of childhood obesity should be avoided at all costs. By starting with such a negative health history, it is almost guaranteed that the child will have major issues as an adult. Due to childhood obesity, nurses now also have to combat diseases and conditions that were previously predominantly seen in adults, such as diabetes, cardiovascular disease, high blood pressure, metabolic syndrome, high cholesterol, bone and muscle issues, psychosocial problems, sleep apnea, stroke, heart disease, and cancer.
Obesity is among the easiest medical conditions to recognize, but most difficult to treat. Unhealthy weight gain due to poor diet and lack of exercise is responsible for over 300,000 deaths each year. The annual cost to society for obesity is estimated at nearly $100 billion. Overweight children are much more likely to become overweight adults unless they adopt and maintain healthier patterns of eating and exercise. A few extra pounds do not suggest obesity. However, they may indicate a tendency to gain weight easily and a need for changes in diet and/or exercise. Obesity most commonly begins in childhood between the ages of 5 and 6, and during adolescence, studies have shown that a child who is obese between the ages of 10 and 13 has an 80% chance of becoming an obese adult. For the nurse, the occurrence of childhood obesity poses a serious challenge. 50 years ago, obesity in children was not a common problem. Children were generally healthy and in shape, and when they came to the hospital, it was either for a checkup or for a more normal child-related disease. With the prevalence of childhood obesity in today's children, the nurse's task of diagnosing and fixing the young patient has become much more difficult.
Nurses must not only deal with the more complex inner workings of the child's growing body, which are markedly different from the adult, but also attempt to conquer these previously labeled adult diseases. In comparison to an obese child's peers, the overgrowth of the patient's body in proportion to its normal size is drastic. causing an emotional trauma that the nurse must also address. Clinical depression, lack of self-esteem, and body dysmorphic disorder are all seriously debilitating problems that can be coupled with childhood obesity, which the nurse must confront. If the emotional issues of the child are not handled, then the physical health of the child may not change much, despite great efforts on the part of the nurse and the healthcare team. So it is essential that the nurse not only pay attention to the physical manifestations of childhood obesity, but also the psychological traits as well. Other barriers to nursing in regards to childhood obesity are parental attitudes, the American lifestyle, and the lack of resources on the part of the nurse and the family. There are many opportunities on the part of a nurse for professional involvement. Since most cases of childhood obesity are fully preventable, nurses must recognize that proactive action helps prevent childhood obesity. It can make a world of difference in whether or not a child becomes obese or grows up to become an obese adult. By conducting annual checkups during early childhood that incorporate monitoring BMI and practical education about healthy lifestyle choices, the nurse can help ensure that the child avoids developing childhood obesity or decreases back to a healthy weight. Also, nurses can refer the patient to a dietitian or an exercise physiologist, and can also participate in community outreach programs that are specifically directed towards childhood obesity. While educating the parent or the child about healthy lifestyle choices, 3 main things need to be emphasized: nutrition, daily exercise, and proper family support. The nurse must confront major barriers to fighting childhood obesity while educating the patient and parent. The educational barrier is especially important for the nurse to realize because a lack of education about the basic mechanisms of maintaining health is a principal issue in American society. By recognizing these barriers, the nurse can target them during interaction with the patient and help educate the child and parent about ways to combat these challenges in order to incorporate healthy practices into their daily lives. It is important for the nurse to know statistics about childhood obesity in order to maximize education. Here are a few statistics. 40 to 50% of all money spent on food in the home is spent on food that's eaten outside of the home. Each daily hour of watched television correlates with a 2% increased risk in becoming overweight. Kids who eat with their families 3 or more times per week are more likely to eat healthy foods and are less likely to become obese. Almost 33% of elementary schools and 72% of middle schools have vending machines. Now, these foods are not required to meet FDA nutrition standards, yet they are easily accessible to children.
There are many opportunities in the community for children to get involved in that help foster good health practices. The First Lady, Michelle Obama, has fought tirelessly against childhood obesity. With her campaign, Let's Move, America's move to raise a healthier generation of kids, many nationwide changes have been enacted to combat this disease. Ms. Obama has helped create a website that is a wonderful resource for children and parents and schools to rely on that teach multiple ways and methods in which to stay healthy. Her website emphasizes the 2 main actions that were discussed earlier, eating healthy and staying physically active. Her active role in promoting the fight against childhood obesity has inspired other celebrities to take a stand and influence the public. Beyonce Knowles, a popular R&B singer, created a flash dance video for children to exercise to called Move Your Body. Ruben Studdard, another R&B singer, holds a festival for fitness and music every year. in Birmingham, Alabama. A not-for-profit resource, ChoiceForKids.com, concentrates specifically on children that live in Georgia and is instrumental in providing a free, safe, and supportive environment for children who are at risk or that have been clinically diagnosed with obesity. This program also includes the children's parent in the program, which helps to foster a family-centered environment in which to regain health. With programs such as family fitness workshops, dietary nutritional education, individualized counseling, and peer socialization, they are hitting all the important aspects of obliterating obesity from a child's life.
In conclusion of our wonderful presentation on childhood obesity, here are 2 videos that you can view. The first one is Beyonce's official Move Your Body video, and the second is a group of students in a middle school that were doing Move Your Body in the auditorium, and Beyonce surprises them. Thank you for listening and have a great day.